Let's begin today's session. Am I audible? Yes. Loving homeopathic doctors, people working in various fields of homeopathy, relatives, friends, well-wishers, and masters of homeopathy. Good evening, good morning, and good afternoon to all. Let's begin with a 1-minute silent prayer. I welcome you all for the 890th day of Zoom meeting on International Session. Let's join together for another successful day. Before entering to the official day, may I remind you about the IFPH family meeting going to be held on 19th February 23 at Vipin, Ernakulam. I welcome you all, your cooperation, presence, and prayers. Also, do support the event with your valuable and possible contributions. Let us join together to make the meetup a grand success. It's time to introduce the guest for today. It's my indeed pleasure to welcome Dr. Harish Kumar H, our guest for today. Doctor is the Chief Consultant at HARISH Homeopathy at Kalamassery and Kurumasheri. He has more than 19 years of experience. He was University second rank holder. He is also JCI National Trainer. Doctor is as familiar as for the forum as he has taken many sessions for the forum. His last class was on the topic, some interesting rubrics. Today he is here to continue on the same. With all due respect and love, I welcome you, sir. Welcome, sir, for today's session.
Thank you, Doctor.
Welcome. Sir, some net issue is there, sir. Some net issue is there, sir. It's breaking the voice.
Voice is breaking? Okay. Right.
Yeah. Ah.
Now?
Yes, sir. Now you're audible, sir.
Okay, right.
But video is not.
Yeah. What
yes,
about now?
Okay. Yes, sir. Okay.
Okay.
Perfect. Sir.
Perfect. Okay, thank you. So, shall I start?
Yes, sir. Instant.
Okay. So once again, thank you very much for inviting me once again. It is a privilege to be here again and again. And it is very much happy that this organization is doing a great job across the world. Now, without much any what I call formalities, I am just going to the content. Maybe we will have much more.
Sir, net issue is continuing, sir. Sir. Yes, sir. Okay.
Change the network. Maybe I may exit and I will join again. Okay, right.
Okay, sir. Okay, sir. Okay. The guest will join as soon as possible as he has some net issue.
Is it okay now?
Yes, sir. Yes.
Thank you.
Sir.
Yeah, so this is a topic in which everyone can come up with their own point of views, and this is not any, I am not pertaining to any particular subject. It is a wide subject, some interesting rubrics. That is the only content or title that I have given. So everybody will have their own interesting rubrics, or may have experienced certain interesting things in their career. So this is something that I recently, almost 3 to 4 rubrics I recently, what do you call, got into acquaintance. Only one rubric is something that which I had acquaintance around maybe 10 to 15 years back in the starting of my career. So the point I want to, before that, is it visible? Is it
Yes,
visible?
sir, it's visible, yes, sir.
Okay, right. So now you can see the topic. There's some interesting rubrics, and I made the interesting in a different color, red color, because it is a disclaimer. Because these are interesting for me, it may not be interesting for me, any other people who is sitting over here, because these rubrics actually gave me an insight or a different perspective of the remedy or the case in itself. So that is why I have interesting. So everyone will have their own interesting rubrics when they have gone through their career at one point or other point. They have definitely have gone through certain interesting rubrics. So this will be a session where I will talk very less, and after that, definitely everyone can give their own experiences of interesting rubrics. Okay, right. So now we will go to the first one. Okay. This was a case actually recently. Now we all know that we are facing a huge number of upper respiratory and lower respiratory infections and diseases, of fever, and maybe asthmatic issues. And this is something that there is an acute phase that has been happened maybe last 2 months after the onset of winter. We are seeing a lot of cases, especially in Kerala. We are seeing a lot of cases of respiratory tract infections. So in previous years, it was not that. Maybe after the COVID, we have what do you call, removed all the masks. Definitely, it has resulted in an increase in case of respiratory infection. This is what I perceive over the last 2 months. And the most when it was compared to maybe the pre-COVID era. Most probably it may be due to the reduced immunity or reduced defense mechanism of the people, because we have been living in a protected environment for the last couple of years. So this was a case of respiratory infection, and it is fever and cough was the major symptom. I am not telling the complete symptomatology, but I will be discussing on the points that we have to discuss only. It was a typical case of fever and cough. It was been CRP was around 100 first time when they came to me. I gave a medicine and it came down immediately. Fever came down immediately. Cough came down immediately. Another 5 days CRP came down to around 6, and the next week it came down to 1.5. So that is the case. But after that, after 1 week, it again recurred, fever and cough. I gave some medicine, it reduced. Then again, he was okay for another 1 week. Then again, this case reappeared, and this time cough was severe. That he was continuously coughing. There was no respite, and when I heard even they record the voice of cough at night time, and they sent to me, and it was like you cannot tolerate such cough. And it went through, and I gave almost all the remedies that we always give: Corallium rubrum, Coccus cacti, Epicac, Antitar, Causticum, Phosphorus, Hepazole. Everything was given around in a 10 days time. I had repeated. I tried all these remedies. In no way it was getting down. And I discussed with my friends, and he said, and it was my friends also, when they heard, they assured my my observation that it was a Kurupi cough, and let's try for the trio of group, and we gave Aconite, Spongia, Hepazole, absolutely no result. It was increasing day by day. And then I retook the case, and I from the physical aspect, I inquired about the mental area or mental symptoms that is happening. And one common symptom, maybe I may say, a common symptom that I got was carried desire to be over the shoulders. And if you see this Ina Chamomilla, and I think Pulsar and Stanum is there, I think. And I gave Stanum because it is a very Pulsar I had already given. And Stanum is a case where there is profuse weakness after cough, and I gave absolutely no result. Then just I was passing through the repertory, and one symptom came to my notice, or one rubric, and that is carried desire to be grouped. And when you look, there is only one remedy in repertory, carried desire to be grouped, and that is bromium. And I gave bromium 200, and it worked like just a magic. Within a few minutes, the cough came down, and in another 1 to 2 days, he was completely relieved of cough. And for the last 2 to 3 weeks, he is not complaining of this. And take it from me, I have read bromium, I have heard about bromium, I have given bromium once or twice, but I had never noticed this rubric, carried desire to be grouped in. And this is a rubric which actually struck me, and that's why I like to share it with you. Carried desire to be grouped in. Actually, I came to bromium after, I will admit, because otherwise it would be a failure from my part. Almost I tried 10 to 12 remedies in a span of maybe 10 to 15 days. And I am a person who very seldom repeat a remedy, seldom change a remedy. But this was a case which forced me to do all the things. And this actually, I am very much happy that this rubric came up. It stuck like anything, because over the shoulder, and just I checked the rubric group in, then I saw this bromium. So that is a one rubric. And the second one I want to discuss is this is a person who is known to me, very close to me. He's a friend of mine, and he had a severe cough. He was having a severe cough, and it cough started after he helped his wife in his house, cleaned the room, and he sweated a lot. And after that, he drank plenty of cold water, and the next day, the entire process started. It was severe cough, sore. His throat was sore. It was very paining, and I gave first. I think I gave Hepaself. It didn't work. Then I gave causticum, and then it didn't work. I thought the soreness was the key point that I thought about causticum. Then it didn't work. Then I again took the case. Dryness was there, thirst was there, profuse sputum was there, and whenever they cough, there is severe pain in throat. And I thought that it could be a case of bryonia, and the possession also indicated bryonia, and bryonia didn't work. Then during our consultation, and he was a friend of mine, so it was not a professional consultation. Over phone, he said it is like he feel like there is a severe ulcer. It is there in his throat, and whenever he coughs, the pain in the throat is so severe. It feels like something is going through a ulcer, and that sort of ulcerative pain. That is what he is feeling, and he said that my issue is not with the cough. I can cough a lot, no issue. I can bear this cough, but the pain that is coming in is the most biggest issue for him. So I took the rubric: throat pain, cough during aggravation, ulcerative pain, and that is the sensation that he explained, ulcerative pain. And if you go to the repertory, there will be only one remedy, and that is capsicum. And I had given capsicum for cancer meningioma case, and it gave me a fantastic result. I have heard about capsicum cough in college. I have studied, I have by hearted, I have scored marks, but never ever in the last 2 decades of my experience, I never have given capsicum for a cough case. And this case, or this remedy worked like a magic. Immediately after capsicum, he after half an hour he called me and he said that that pain has come down a lot. Thank you very much, dear. So that is the way it worked. And next day he was not at all complaining about the pain, and his cough was also reducing. And within 48 hours he was almost 100% cured. But the thing is that why I could reach this point is, or reach this rubric is, or reach this medicine is because of the way he explained his symptom, the sensation that he felt. It was very well explained or delivered to me. That is why I could come up with this rubric. So it is very important when you take a case, you should educate the patients that the why we are inquiring symptoms in a detail, why we are going for a micro detailing. This is all because we need to get that exact sensation or feeling that the patient is having. And if somebody, if anybody who is not a doctor here sitting here, definitely if you go to a doctor, definitely you try to see, you see that you are explaining every symptom in the micro detail level so that the doctor can understand. And whatever the doctor asks you, give an honest answer, because these micro detailing will help in understanding or getting into the root of the case, and definitely help you cure faster. So throat pain, cough during ulcerative pain, capsicum is some another interesting rubric I came to interact at this time. Sorry. And there is another one, and I read the capsicum after that, and I could remember all those symptoms that I by hearted during my college days to get marks. Even the when you cough a lot, there will be a bad odor coming to your mouth and nose, and all those sort of symptoms I remembered. But another rubric that came, or another symptom that I read or struck me when I read capsicum was that cough anger after. Cough immediately after anger. And as I said, this person is close to me, is a friend of mine. And the day he drank cold water, which I took as a causative reason, that day he had a good enough fight with his friend, another friend of our common friend, and he was very much angered with what has happened on that day. And I missed that. Actually, if you see cough anger after, I think there is capsicum. Very few remedies, 3 or 4 remedies only. No, anyway, less than 15 remedies for cough anger after, and you can see capsicum in 2 marks. So that is another interesting rubric that struck me, cough anger after. You cannot take cough anger after if the cough is happening 10 days after the anger issue. In this case, it happened within 6 or 7 hours. That's right. Okay. So third rubric. Okay, right. This was a case which came to me last month, and it was a case of hair fall, and she had she's a 6 to 7 year old girl, and she had what do you call dry eruptions, eczema like eruptions. It was both on the back of thighs. It was symmetrical also. That was one complaint, and another complaint she had was not even 7. She was around 4 to 5 years only. She was like little child. And another issue that was worrying her mother was that there is severe, profound hair fall. And when I looked into this rubric, head hair falling, children in. I take head hair falling only, and I take other what do you call other physical journals and mental journals to fill up the case. But in this case, I thought if 5 year or 4 to 5 year child having severe hair fall, then I thought it is not alopecia, it is just falling from every part. Okay. So I took the case and took this rubric, head hair falling, children in, and when I saw there was only one remedy, it is natramur. And this child is a person who steals salt if nobody is looking after. And another rubric that I got, striking rubric, was that just I said there was eruptions on the back of the eyes, and it was symmetrical, typical on the both sides, same area, same type of lesions, and same area covered. And this is a very syphilitic rubric. When you see a symmetrical lesions, it is usually a deep syphilitic case of deep syphilitic remedy. And hair fall happening at the age of 4 or 5, profound hair fall, it is definitely a syphilitic case. And I just rechecked that rubric, skin eruptions symmetrical, and in that also there are only 6 to 7 remedies, and natramur is coming up. So arnica, crotondic, lactifloratum, neptonium, sepia, silicea, thyroidinum, all are the other remedies, but in that also natramur is there. So I gave natramur, and in the follow-up, I could get a report from the parent that hair falling has reduced a lot, and eruptions are almost standstill, and that is good because first of all, the syphilitic rubric should get improved first. Then only we should go for the psoriatic symptoms. Okay, so what do you call, the proper way of curing is happening. I think it is only first follow-up is only happen. Maybe in another next time when we will be discussing, definitely we will be able to disclose much more details about this case. But this rubric was interesting. I noted for the first time only head hair falling children in natramur. Okay, this rubric skin eruption symmetrical I usually take in almost all the deep syphilitic cases where there is symmetrical lesions that is happening. A lot of psoriatic cases I had experience of having eruption symmetrical. So that was not a news to me. It was not new to me. But head hair falling children in was a new rubric for me, interesting rubric for me, and it is natramur. And this rubric, sorry. Yeah, this is a case of actually this was a case of liver cirrhosis, and this patient was actually treated by allopathic medicines, and there was not much improvement. Of course, he went to a hepatic coma and he recovered from that, but otherwise recovered from hospitalization and the intensive care they have giving. But after that, it was like he was just surviving. That's all. He couldn't have good food. He cannot eat food. He could not have the taste. His energy was totally low. He was bedridden all out. And he came to us, and we prescribed. I exactly don't remember the exact remedy that time. I will tell the rubric now. But before that, the first prescription was something different. And he improved a lot. Okay, he improved a lot in the way that he started having food. He started having, he could sit up in the bed and move to the bathroom and all that. His taste came back and the energy level came back. The dark discoloration of cirrhosis, it came down and his face became pleasant. And he was improving. And all of a sudden, he had again a relapse. You know, when it comes to severe cases of fatal disease, you ought to expect such relapses. And this relapse was severe, and he was suffering from severe pain. And I repeated the constitutional remedy. There was no relief. I tried for some complementary remedies, no relief. Those are days where I gave only a single remedy, and I will wait single dose and wait for a lot of time. And there was no change happening. And one night they called me around 2 o'clock or 3 o'clock. Doctor, you should come to our house immediately. We will send some vehicle. You please come. I think he is going to have a last breath. He is going to die. He want to meet you immediately. And I went around 4:30, 5 o'clock. I reached his home, and the first word he said that. I will tell in Malayalam for the people who is listening. That is a current exact word. Then only you will understand. Doctor, ഈ വേദന എനിക്ക് സഹിക്കാൻ ഈ വേദന കാരണം ഞാൻ മരിച്ചു പോകുമോ എന്ന് ഭയങ്കരമായിട്ടുള്ള പേടിയാണ്. The face was of intense fear, and what he explained was, I will converted it into English, the word he said that, doctor, I fear that I will die out of this pain. Help me somehow. That is the word that he used, and it just not like this way, in an animated way, and in an intense way. He requested, not request, actually, he's ordered me to reduce that pain. So I took the case, and there were 4 to 5 rubrics I could see in that case. But the striking rubric or the interesting rubric I took was mind, fear, death of pains from. And there are around 5 remedies, 5 or 6 remedies, and the 3-mark remedies, 2 of the 3-mark remedies was coffea and kali iodator. Just let me just recheck all the other remedies. Yeah, Anantaram, muriaticum, asalb, cactus, naja, and oleander are the other remedies, and coffea, and these are all 1-mark remedies, and coffea and kali iodator was 3-mark remedies. And I gave coffea 30, 1 drop diluted in quarter glass of water, and gave him 1 spoon. And in 10 minutes time, he went to sleep after 3 days. He was suffering for 3 days and he couldn't sleep. And in that moment, within 10 minutes of giving coffea 30, this patient slept. And I waited there over there for another 3 hours. I just want to see how he responds. And for the 3 hours, he didn't wake up. And I came back to my home, yes, my clinic, and I started. And afternoon, he wake up and he thanked, and he said that, doctor, the pain is almost 95% over. I can manage myself. Thank you very much. That is the thing that I said. And he survived for another 6 months. And the sad part of the stories or the anticlimax is that this patient was improving fast. Liver function tests were improving. His scan was showing the cirrhosis lesions, but the symptomatically, and he was improving, and his liver functions was improving fast. And unfortunately, at that moment, he was an alcoholic actually, and he has been advised to stop alcohol. And for the last maybe 3-4 years, he hasn't drank anything. And one day, one of his friend came to him and advised that, yeah, it is only about the foreign liquor that is a problem. You can have toddy, it is not a problem. It is taken directly from the coconut tree. It is natural. There is no mixing of any chemicals. So you can have this toddy and all that. And he drank it. And within 2 to 3 days, liver cirrhosis spurred up. Labs started, severe bleeding and vomiting started. I couldn't do anything because immediately they had to shift to the hospital, and he passed away in another 2 to 3 days. So that is the anticlimax that happened. But the learning that I had is this: the fear, death of pains from coffea, kali iodator are spectacular remedies. And another factor which I understood very sadly is that whatever you say as a doctor, whatever you say as restrictions, they have their own interests, their own likings. And if somebody authenticates that it is okay, dude, you can do this, and in such cases they will feel trapped to those things. And being a doctor, you have to just sit and be helpless at those moments. These are hard truths in life that I think every one of us have gone through. So this is a case, fear. And I will, there is another rubric. Yeah, fear, death of pains from toothache, and oleander is a remedy. It was news to me. That is why I am sharing. I have not typed on the PowerPoint, but there is a rubric called mind, fear, death of pains from toothache. If somebody has severe fear of death from toothache, oleander could be a remedy. And it is only one remedy rubric. And if it happens to you, if somebody comes and specifically say like this, you can give it a try. Oleander, I have only understood it is a good remedy for skin diseases. And this symptom is new to me. So I just wanted to share with you. Okay. And this is a case. I'm going to the last part of this session, and we will have a discussion after that. This is a case of cancer which is teaching me a lot because actually this is a case which is I am handling for the last 2 months, and very, very tough case. Honestly speaking, I don't know where it is going. Hello, can you hear me?
Yes, sir. Yes, yes.
Thank you. Yeah. So this is a case which is teaching me a lot. For as I said, I don't know where it is heading, because when he came to me, he was suffering from actually. He had a metastatic cancer in the liver. It was primary lesion was in colon. It was operated upon, and he was okay for a few months, and after that he again started having loss of appetite, weight loss, nausea, and all that. And they went for a USG and MRI, and the cancer, metastatic cancer, adenocarcinoma is not adenoma, squamous cell carcinoma is evident. And CEA was 17 or 18 something, and they came to me. He was not having any appetite. There was profound weakness, and there was no taste for food, and he had a pain in the hypochondrium and a pain in the left shoulder. Okay, so I suspect a metastatic cancer in the bone also. It is not examined, but not investigated, but I suspect. And I took the case, and I went for the constitutional remedy. It was phosphorus, and I gave phosphorus 30, and Cardus marianus tincture also I gave. And within 5 days, this CEA level came down from 18 to 11 or 12 something, and I was very much happy. Patients were happy, and more than that, appetite came back, weakness came down. He was going back. He was helping his son in the job, in their business, but he was involving more. And it was a fairy tale ending, not fairy tale ending. It was a fairy tale start for me, but the happiness didn't last long. And the next time when he came, the weakness started again. Appetite was lost again. CEA went back from 12 to 25, and now things was not good. I went to Ken's writings, and it is very well written that if a case improves immediately and it is lapsing again, and especially when it is a disease like deep pathological cases, definitely it may be an incurable case. Whatever you do, it will head to only one end. So that is something that I fear in this case, because I had experiences where in cancer cases where when we gave the medicine, it gives immediate relief for maybe a few weeks or few months, and then it came back and went to the ultimate end. But still, they are all good cases, because most of them were painless deaths. So this is a case where I was stuck, and I discuss with my friends. I usually do that. My college friends are all very good practitioners, so I do discuss. We all do discuss, and at that moment, one of my buddy also said that, "Arey yaar, this is in the 12 observation you have read. If it is improved first, and if it is again coming back, there is high chance of it being an incurable case. So you go for a palliation. Don't give any constitutional remedy." And I was giving Chivanandas, Hydrastis, and all that, but it was not getting cured. Not getting rid. The CEA was increasing from 25 to 30, 33, 37, 40. And meanwhile, I discussed with one of my friend, and he said, in severe cases of cancer, you can give calendula tincture in small doses, because he has observed that it is giving good result. And at the same time, I was going through the rubrics, and I saw a rubric called abdomen cancer liver metastasis, and only one remedy, and that is calendula. And we have been using calendula for years for wounds, injuries, and all those stuff. but abdomen cancer, liver metastasis, calendula is only one remedy. And I gave calendula and tincture 10 drops twice a day. And I was giving some other remedy also, one more remedy that I didn't remember exactly. I think it was card 6C or something. Okay. Anyways, after this calendula tincture, his appetite came back, his weakness came down, he started to do the jobs regularly. But CA is still on a higher note. And I retook the case. And another point that I want to tell is that in between all these things, he had a cardiac arrest. And but he didn't take any, especially I think it was after phosphorus. First dose of phosphorus, he was improving. And after that, he had a case of cardiac arrest. Not cardiac arrest, myocardial infarction. And he went to allopathic hospital immediately because there was changes in ECG. And they advised angioplasty, but he didn't take that. He just had got some medicines, internal medicines only. Streptokinase injection was taken, and he is on oral cardiac medicines. Okay, that is something that happened in between this case. And actually, I considered those rubrics, the cardiac aspects, but I never. I was focusing more on the cancer issue because that is taken care of by those medicines, and I don't know what will happen in the future. But definitely, when it comes to cancer symptoms, they are very much concerned because of the CEA level getting increased. And last time when I saw, it was 54. It came from 18 to it came to 54, but his symptoms are improving. That is the funniest thing. He is okay. He is living. He is earning. He can go to the job. He can have. I have given basic restrictions regarding the liver cancers, like don't have meat or excess of fat, all that. Otherwise, he is having normal food, and he is having good sleep. And he has an average energy level. It's not a big issue. And more than that, he has gained the weight also. And these are all the positive things. But two symptoms, that is the pain in the hypochondrium also has gone down. Two symptoms, that is one sign and one symptom that is persisting, is that one, pain in the left shoulder and left arm. I think it is a metastatic pain. And second thing is the CEA level is increasing. And meanwhile, I again retook the case, and around 5 to 6 symptoms I had, and I forgot to insert that picture into here. Maybe during the introduction, I will find out the rubrics and I will tell you. Anyway, in that, during our discussion, like that is the point I want to tell you. During our doctor's discussion, one of our doctors said that in cancer cases, when you usually take the symptoms, you will get the common polycrust remedies only. But in the top 10, if you have a rare remedy coming up, even if it is a 10th position, you should consider that. And then we usually do that. And that point struck me. And in that case, in the 10th or 9th or 10th position, a remedy came, and that was asafoetida. Asafoetida was a remedy which came up. And actually, this patient is on asafoetida now. And asafoetida is something which I always related with gastric issues. And when you see cancer bones, there is asafoetida. And pain left joint, I think it is. I think all the rubrics I gave, asafoetida was covering. And asafoetida, when you go through the materia medica, it is a good remedy for cancer, especially metastatic cancer and cancerous pains also. And that is a news. It was a news to me. Asafoetida, I was always thinking about belching and gastric issues that is always happening. But now this cancer is teaching me about asafoetida, and maybe I don't know what all things I will be able to learn from this case. And he's surviving. I don't know what will happen to him in the future, but definitely he's surviving in a good way. And hope something good will come up. Anybody who is sitting here, if they can put more light on this case, definitely it will be highly appreciated. And with that, I end my small session. Okay. Okay, I have stopped
Yes.
the sharing. So these are the five, actually it was 5 to 6 rubrics only I have discussed. But these are what I call struck me at one time. It just stuck me. That's it. And I thought sharing with you. You may be having much more interesting and much more number of interesting rubrics in your sleeves. So definitely you may all share and we will have a discussion. I think it is 8:40, so we have 10 to 15 minutes to discuss. If you have any doubts, definitely you can ask. I will be trying my best to clear it. Otherwise, we will have a discussion. So thank you, Dr. Elizabeth, for coordinating this session. Thank you very much. Over to you.
Thank you, sir. Thank you. It was such a wonderful and helpful class, sir, because you, as you said, you had only discussed 4 to 5 symptoms, but it was very uncommon symptoms and uncommon rubrics, sir. So thank you very much. And you have explained very nicely how to take a rubric from a symptom. In the case you explained also, you have explained it very clearly. So I think it will be very helpful to all. And I feel many doctors will be having suggestions like this, rubrics like this, how to convert rubrics from symptoms. So I welcome each and everyone to share their thoughts. Please discuss with sir if you have any doubts to find out any rubrics, like anything you can share. As you hand raise, we will unmute and you can speak. You can write in chat box also about your doubts, so we can clear in public. You can write in chat box also. So
Yeah.
Dr. Hariharan has raised his hand. Sir, unmute and speak, sir. Hariharan, sir.
Dr. Harish,
Yes,
very
sir.
nice presentation.
Thank
See,
you.
every homeopath have experience like you. I think, see, I am having also such experiences, but I am not written or recorded like you. But see, the difficulty is that homeopathic doctors are not observing too much. Homeopathic doctors must observe very clearly, then only he will get the symptom and we can convert it to a rubric. See, one of my doubt is that you please explain for the participants that,
Okay, sir.
see how you are grading the symptoms.
Yeah. Okay. Right. When it comes to grading, it is very tricky area. If the patient himself or herself express that symptom prima facie or immediately when they during their consult or their what do you call it, the first time when we hear to the way they explain the symptom, if they are explaining those symptoms, definitely that means that symptom is having some sort of intensity. That is why he has noted it. That is one way of taking it. Another, how much it is uncommon to that case. That is another thing. For example, what do you, how can you say? If you expect a symptom in a patient, then it is not that much important. But when you see a symptom which is totally surprising in that case, definitely it has more importance. Maybe in another 5 minutes I will get some example. Definitely I will come to that. But maybe severe aversion to sugar in a case of diabetes mellitus, not because of fear of diabetes, but he does not want. He does not have any liking to sugar. Or in a case of hypertension, he does not. He have a severe aversion to salt. Then that is a case where it is uncommon, or that is a case that is actually surprise for you, right? We call something negative journals or something. That is something that we have taught or read in repertory. Negative symptom or something. The point is that when a symptom is expected and you see a totally unexpected symptom in that case, definitely that calls for a higher intensity. Then the way the patient feels, sometimes we can feel that symptom in that patient. You can sense it. Then definitely that is more important. Then how much severe it is, or pathologically how much severe it is. If you have a severe pain in a case of cirrhosis and there is bleeding, definitely that should give a higher importance rather than to other symptoms. How much fatal this symptom can be, that is also that we have to consider. These are the points that I usually take. There may be different ways of approaching it. The symptom, once again I will summarize the importance that the patient is giving it, the suffering that he is having, the intensity of the disease, the uncommonness of the symptom, and definitely the fatality of that disease. These are the things that I usually consider. And if it is it is a recent symptom, then also it has a more important. If it has been it has been symptom that has been with him for a longer period, it doesn't warrant a high intensity. But if it is a very recent symptom, definitely, for example, who has been very chilly person throughout his life and he has suddenly become hot patient, and she is not in a menopause phase, then definitely it calls for a and definitely he or she should not be anemic. She should not be a menopause, because it could be a symptom that has happened to him recently and without any pathological explanation. Then that calls for another higher intensity. This is the way I think. I am sharing my thought process, and need not be the perfect one, but definitely this is how I think.
If it is no others, let me ask another question, Dr. Elizabeth.
Yes, sir. Yes. Okay, sir.
Okay, doctor, why we are taking the case and concluding a remedy and getting a remedy that suppose it is Naxomica and the patient is hot, then how we will prescribe that Naxomica?
Right. In my initial days, I was an ardent follower of thermals and sites. And honestly, I failed or I destroyed many cases because of that obsession that I had. Later on, I'm not saying that Naxomica is not chilly, okay, or Naxomica, Naxomica is not, that is not the point. Naxomica is generally chilly, but if you take any cases, if you see heat sensation of, I don't know, but if you check heat sensation, there is every chance that Naxomica will be in 1 mark. So it has been proved somewhere, and it can be explained in our miasmatic way, because when a remedy is having the 3 phases, syphilis, psychosis, and psoric phases, there can be symptoms which is contradictory to what we have perceived. For example, sulfur is a remedy which is considered as a ragged philosopher, and we think that sulfur is a person who will wear only bad clothes and all that nasty and filthy clothes. No, sulfur in a psoric or especially in the psychotic phase of a sulfur, he will be absolutely brilliant to see, and he will be dressed in the most fastidious manner, most neat manner. But when that sulfur patient goes into the syphilitic phase of pathology, physically, mentally, and all other aspects, definitely then we will see that depressive phase or rag philosopher phase. So you cannot judge a case or judge a remedy just for one symptom. The totality should be considered. If the total theme is covering with Naxomica, and if he is still he is hot remedy, then you can think about when the even if it is a hot patient, but all other symptoms are indicating Naxomica, then definitely you should not rule out Naxomica just because it is not a chilly remedy. This is the experience that I learned in the second half of my career. In the first half, I would have made that mistake. Now I will not rule out just because of one remedy. Definitely 2-3 remedies, if it is contradicting, definitely I will not go for that. But otherwise,
okay. Okay. I have, but Dr. Manoj is raised the hand. But after that, I will try. I will time. Another question is also for me, please.
Okay, sir. Okay. Now Dr. Manoj has raised the hand. Sir, you can talk.
Thank you. I think it's the duty imminent upon me to congratulate Dr. Harish because of a wonderful explanation. And the most important thing is that, as Dr. rightly said, there are no accidents in nature. The patient got cough, the ulcerative pain throat. There was an exciting cause, that is after anger. So each and every point is very important, and we can see our guest is always coughing and he's drinking water. I think it is cold water, maybe caustic. So just like that, always we should have a observation. Very nice presentation. It proved that you are a real genius. Thank you, doctor. Congratulations.
thank you, Doctor. Pleasure to hear from that, sir. Thank you.
Okay. At any time, Dr. Elizabeth.
Yes, sir. Yes.
Okay. Doctor, last day I have a case, and then I concluded that I took the case, and finally I understood that he is an arsenic patient. But that patient is cold patient. Then I became confused. Then I switched over the my prescription to arsenic iode. Arsenic iode. But 3 days after, the patient came and said to me that I am having very good relief. This is my experience.
Yeah. Yes. It happens, doctor, because in my experience also such things have happened. And when you asked about Naxomica, if you had asked about some minerals, then I would have gone for another.
That I know, doctor.
Because we had experience personally, and also my friends also when we discussed, because in certain cases we feel that it is a typical case of calcarea carb, but he is having very strong heat or strong aversion to egg, or if constitution may be different. And in such cases, we that is actually the benefit of having combination in the sense, what do you call, group study. Yeah, groups. That is the benefit of group studies. I think I have explained in one of my sessions. Group study is the benefit is that when you have a calcarea, and if it is a calcarea group, that is for sure, you can choose from other hot calcareas also. That is one way of doing things. Absolutely no wrong in that. And I think many my seniors, including you, have more experience than me. Definitely, I have also tried such aspects, and definitely have got a better relief in many cases.
Okay, doctor. Like you, there are few genius only. You are a genius. Congratulating you.
Thank you.
Thank you very much.
Thank you, sir. Thank you, Dr. Hariharan, sir. As he has cleared doubts, now Dr. Pranav has raised his hands. Now you can speak, doctor. You can unmute yourself, sir.
Namaste.
Yes.
Sir, you have always been my inspiration in presenting the case, as well as in the success you're giving to the patients. And we really like your presentation today. And the opinion you gave upon sulfur is the same what I had on arsenicum also. The arsenicum is the most fastidious, but then too their ulcers and all are very offensive in nature. So in some point of time, even arsenicum become very rugged, and their appearances also change as the time, as the miasm proceeds. So I really second with your opinion, and thank you for your session, sir.
Right. Thank you, doctor. Thank you, doctor. Actually, it is one of the most offensive remedy is arsenic alum. So it is when it comes to that syphilitic phase, we saw a different aspect of what do you call arsenic. I had an experience because this was a case in the first year of my practice, way back in 2003. It was a case of asthma, a 14-year-old girl, and that was a case when I repertorized. It is a typical classical case of lachesis. All the points are, when all the boxes are, you can tick. It is typical case of lachesis, except one symptom. She is very reserved.
Okay, sir.
And I gave Natramur. I gave all other similar reserved remedies. No result. And I, with great skepticism and self-pity, I gave lachesis, and believe me or not, within 2 to 3 days, that the intensity was came down, and around in another 2 months time she was cured. 2 to 3 months she was completely cured. She was suffering for around 10 to 12 years from the childhood. She was infancy, from days she was suffering, and it cured in 3 to 4 months. She was completely cured. And that was a revelation, because that is the first time I thought, oh, lachesis can be reserved also, taciturn also. So that happened. This is all because of the miasm. When you go through the 3 miasms, when you see them, especially in polycrust remedies, especially in polycrust remedies, they have that all the coverage in all the 3 miasms. So we have to understand in that perspective. So thank you, Dr. Pranav, for
One more
taking
thing.
me to that memory. Thank you.
Okay, sir. As we
yeah.
are running short of time, you can clear your doubts as fast as possible.
Yes, ma'am. The other thing is that the use of repertory and use of pure mathematica breaks our prejudices. Because if you see a desire for eggs, calcarea carb is there. Aversion to eggs also, calcarea carb does comes.
Yes.
So our prejudices breaks as when we go through the repertory as well as the materia medica. So thank you.
That's why our master has said, be an unprejudiced observer.
Exactly, sir. Thank you.
Okay, now Dr. Danesh sir can speak.
Good evening, Dr. Harish. It's really another thrilling day from you, thrilling performance from you, because rubric is one of the area where most of the doctors struggle a little bit when you look into the repertorization. But you have shown how beautifully how to grade the symptoms and how the marks should be given or marks shall be given to a question by Dr. Hariharan. That itself is one of the things most of the doctors does not know. But this really, this kind of presentations are the need of the hour, because we people need to start, particularly the junior doctors need more and more belief in homeopathy by way of this repertorization. They can choose the confusion, or actually people get confused when how to move forward when you get 3 remedies the same grade. Then you will have to choose the remedies according to the temperament, or sometimes to the constitution aspect, or sometimes to the causation factors like that. What's your opinion on that, doctor?
Pardon, can you repeat that question once again?
Last part. Usually people get confused when you, for example, 3 medicines come out with the same grade, and some in those conditions, people used to say that you can go choose the remedy by means of temperament, or by choose the remedy by means of constitution, or choose the remedy by way of by causation. How will you, which is the best as far as you are concerned?
Understood. Actually, I won't say that there is anything best. It depends upon all the according to the situation only. Basically, the rules have been set, but definitely different cases demands different solutions. Okay, so in certain cases we may go to what I do is that first thing is the totality. The case should cover in total, and especially when you are strongly covering the mentals, that mentals, there should be undisputable mentals. It is not something that we interpret and give. It should be strong enough, especially when it is an intellectual symptom, not an emotional thing. When it is an intellectual, for example, he is dull. That is something that we can easily understand. And if he is intelligent or intellectual or mathematics ability for, these are things that is you cannot dispute. If he is coming strongly covering that mental symptoms, and the pathology also, it is also important, especially when it is a deep pathological case. So these and the totality, these are the first thing that I look. And when regarding the what do you call differentiation of the top remedies.
Excuse me, sir. Sorry to excuse. We are in short of time.
Yeah.
Can
Okay.
you please first?
Okay. Okay. Right. And then we will have a huge discussion about it next time. But definitely, finish in one point. Every case will have. I have taken a case called breaking the nuts in different ways. So every case will be needing different keys. So methods will be different, but definitely we'll have to differentiate. The three points is that it is the knowledge of your knowledge in metronymic and your knowledge in repertory will definitely help you. That is the single point I can say. Definitely we will address this point in another next time. Definitely, I will remember this question and I will answer. Thank you, doctor, for giving me this opportunity.
Thank you, sir. Now, in short of time, I render my vote of thanks. It's my privilege to deliver the vote of thanks to Dr. Harish. On behalf of everyone present here, I would like to extend my heartfelt gratitude to esteemed guest, Dr. Harish Kumar. Thank you, Doctor, for such a worthy and thoughtful class. We expect more classes from you, sir, for next time. Thank you, sir. Now, I thank each and everyone who was present for this session. I would like to remind you about the IFPH family meet. Please do cooperate as we have to make it a grand success. Now it's the time for Malayalam session. I welcome Dr. Ashok Kumar for the Malayalam session.
Thank you, Dr. Elizabeth.